It is back with Dr. LouAnn Woodward. Okay, let me ask you this, because it was over the weekend. It happened on Friday. I started getting some information about this when physicians who spread misinformation about the COVID-19 vaccine could now have their license to practice medicine suspended or completely revoked. According to a new policy adopted by the Mississippi State Board of Medical Licensure, doctors have an ethical and professional responsibility to practice medicine in the best interest of their patients and share factual and scientifically grounded information with them. Policy says the physician, recognize it or not, possess a high degree of public trust due to their specialized knowledge. Policy strongly recommends physicians separate their personal and professional content online. This has raised the ire of a lot of doctors and physicians in our state. Your thoughts on this?
So my thoughts on that is this is a very serious move by the Board of Medical Licensure. And I think it is in reaction to the fact that we have had patients all across the state who have reported that part of their hesitancy in getting the vaccine is because they were told by their physician that maybe they didn't need it. And, you know, that really just adds to the confusion of people when they are trying to seek medical guidance and seek information and advice on what to do. So when one group of physicians is saying, yes, it's safe and you should do it, and another one is saying, well, I don't know, I might wait a little bit. So I think that this is just a step that the board, it's kind of their stick that they have. So we have really got to be on the same page, and we have got to use the science and use the formal and official recommendations and advise our patients in that way.
And we could talk more about this, and I'll save that for another program. Dr. Cleveland has agreed to come on with me. I talked to him on Friday, and I think, and I'm paraphrasing him now, he said basically, I think he said, for the most part, it was taken out of context, but we'll find out more when he comes on. I was mentioning this other study when we got on this morning, and it was about the how much of the vaccinated people, how much was left as far as the immunity. Have you seen any new studies on that one? The immunity after about 6 or 7 months?
So I have not seen anything that I would put in the category of new. You know, what we're seeing is if you've been vaccinated, that we know now up until about 8 months or even a little past 8 months that you've got good, strong immunity.
I think one of the things it said is it was up to 86%. We mentioned that a few moments ago. Survey found the vast majority of unvaccinated Americans, 83%, did not plan on getting the jab. And we've done everything we possibly could to get people to take this. And that survey I saw was a little bit disconcerting. It was CNBC. Change Research did the survey. Survey found that the vast majority of unvaccinated Americans, 83%, do not plan on getting the jab, and there's just basically nothing you can do to convince them. So I don't know what else to do. You?
I don't. You know, I've heard Dr. Dobbs say we will end up with herd immunity the easy way or the hard way. So I hate to think that it has to be the hard way. But, you know, you look at our own statewide numbers, and of the people who have gotten sick and have tested positive, I should say, of our positive test, about 7% of those have ended up in the hospital, and about 2% of those dying. And the vast majority of those, whether you look at hospitals in North Mississippi, Central Mississippi, South Mississippi, the vast majority of those that are really sick in the ICU and that die are unvaccinated. And you would just hope that that in and of itself would help people see that whatever their thoughts are about the vaccine, whether you're concerned because you're in the childbearing age or you had COVID back a year ago and you think maybe I don't need it, really it is the thing to do in all of those scenarios.
But it seems like we're headed to a place where we're going to have the flu shot and the COVID shot on an annual basis for the most part. Do you think so?
I would not be surprised. I think you're right. At least for a few years.
Any news as far as the Mu virus or the other one outside of the realms of what we're experiencing now in the Delta variant?
Well, the good news is it looks like these other variants that have just recently popped up are not nearly as infectious. So that's the good news, and we just have to, I hope and pray that that continues to be the case. The Delta variant, part of what made it so very dangerous is it is extremely infectious.
You got it. Always good talking to you. Thank you so very much. I appreciate it.